Hello, listeners. Welcome to Value Tech with UD. I'm trying to bridge the gap between business and technology by inviting extraordinary leaders from diverse backgrounds and helping our listeners to take their next steps in their career paths. Today, we have an energetic leader from the sales background, and her name is Libby Motto. Libby has over 2 decades of experience in the healthcare industry in the broad range of roles from sales and marketing to technical surgical training to operations in pharmaceutical, medical device, and healthcare technology, working closely with C-suite executives for large organizations. Welcome, Libby.
Well, thank you. Thank you so much for having me. And this is a wonderful opportunity for us to take time to take some of the big concepts that, of course, are in both your world and my world and figure out a way to make them more relatable to one another. So I think this is going to be a great experience and I look forward to it.
Awesome. So whenever I speak, I feel super energetic. You really bring a lot of energy to the table. So is this something you have that naturally, or you acquired it? Because of you are in the sales background.
Well, I don't know that you can really teach energy, but I do think you can certainly, if you're passionate about something and you feel like you are bringing the very best of who you are to something, that there's always sort of that natural energy about you. You could be, programming something new, or you could be literally in the field. But when you are making an impact and you're sort of in your element, there's just a natural, kind of a natural high you get from that. So yes, I mean, that's, some of it obviously is why I feel called to do the sales piece, but I also feel called because I feel so passionate about healthcare. And in this particular case, of course, I've decided to devote the last chapter of my life in the career world to healthcare technology because I really believe that there is a place for technology in healthcare to really transform the delivery models that we have traditionally sort of held true all these years, where we had to have actual live interactions between providers and patients, which isn't always possible.
Hmm. Hmm. Awesome. So why are you so much affected towards this healthcare technology?
So this, of course, predates COVID, but I think one of the things that we all learned from COVID was that healthcare had always sort of held on to these traditional modes of delivery. We had always held on to the, you come into the doctor office when you're sick and you stay away from the doctor's office when you're well. The model is more or less getting turned on its head. Is the idea that let's have more touch points when we're well and fewer touch points when we're sick. Because the problem, of course, as you would imagine, obviously, with something as contagious as COVID or any of the other types of viruses that are out there, with the older populations who have a propensity to be in need of healthcare more often, there is that issue when you are putting people in the same place with others who are sick or others who are immunocompromised, that you're naturally inviting them to actually come out sicker than they went in. So if we can use technology to be able to put us in places that we otherwise wouldn't be able to get to. For example, if you live 50 miles from the closest clinic and all you have is what you think is a flu-like virus of some sort, why would that not be better accomplished from the comfort of your own house, sharing your symptoms with a doctor or other type of clinician, and having them say, here's what you need to do. And that can be accomplished in 15, 20 minutes, as opposed to what it would take for you to get into a car, drive into the city, park the car, the whole thing. So technology has, for the longest time, been waiting for healthcare to be ready for it. And I think it was COVID that really sort of accelerated this real need to say, how are we going to do this on the other side of COVID? Because the last thing we need is for people to feel compelled to come into the ER or urgent cares or even the doctor's offices when they're that sick. If the solution is something that they could do on their own, get a prescription, and then heal at home. So that's, of course, why I find technology so interesting. I think there's also a lot of providers out there who recognize during the pandemic that it is time or past time to do some of these sort of, I don't want to call them routine, but some of these routine type of tasks, the well checks and just following up on something. We've done a course of antibiotics. How are you feeling now? Those kind of things lend itself to a virtual platform as opposed to a more traditional come into the office type of situation. So that's, I mean, again, that's a long winded answer, but it gives you a sense of always feeling like technology had a role to play and feeling like COVID sort of gave us an excuse to really go ahead and push forward with what I think so many had already recognized was coming.
Awesome. That's a fantastic idea. To be honest, I recently had to face a situation to do a employment, drug test and the blood test. I spent almost like a 3 hours to drive and then, give the
Mhm.
blood test and then come back home. That is something can be done in 20 minutes, as you mentioned, using the latest technology, right? I don't think nobody's doing that in space. Yeah, that's very interesting. So, for our listeners who are upcoming tech leaders, or who wants to level up their careers basically, so from the sales background, how do you think the technology is driving these sales basically?
So technology, of course, has has driven sales in the sense that obviously we want to provide the latest and greatest and most innovative products. I think there's also a sales drives technology because there's things that as a engineer, a software engineer, there are going to be gaps in what you would naturally know that a provider is looking for when they're working with a patient, particularly an elderly patient. So let me just make this sort of more tangible. If you were to take the average elderly patient who's over 65, their ability to get on a virtual platform is somewhat limited by their own understanding of how virtual platforms work. So you can imagine there might be situations where the mere fear that they would look, you know, like they were fumbling through all of that can be very, very threatening to an elderly person, and they may say, I can't do that. I'm just going to come in anyway because I can't handle that." So the platforms that the software engineers need to develop have to have very, very simple steps for a new user, one who's not in the corporate world, one who isn't using Cisco today or Zoom tomorrow and is used to interchanging between platforms. How do I fix my speakers? They need very, very simple steps. Or we have to provide them some sort of virtual assistance to get them online before they're actually interacting with their doctor, because that can be a very frustrating situation. So that's why I say sometimes technology drives sales and sometimes sales drives technology, because a salesperson who's out in the field might hear a clinician say, yeah, my older patients won't use this platform. They won't use it because it intimidates them. They don't know how to download it. They don't know what buttons to push. They don't know how to find the microphone. They don't know how to find the camera. So I think part of what we are challenged by as professionals is figuring out how to ingratiate ourselves, help them feel comfortable and welcome into a part of this world that they're not getting a ton of exposure to.
So sales drives technology and technology drives sales. That is very interesting to know. So how is the area of marketing impacts these two?
So again, we have to think through. We have essentially with healthcare technology, you have two users. You have both the clinician as a user, and then you have the end, like the patient as a user. And it wouldn't matter if it's remote patient monitoring or if it's something that the clinician is using, like an EMR or something like that. We have essentially two buyers. And in any B2B model, we know this, but we also have to recognize that the first buyer needs to have something that is facilitating an easier workflow or a faster workflow, more efficient, less error prone, less manual, automated population of certain fields, things that make it easy. for them to do their job. If you do that, you're inviting them to say, hey, this is so simple, Libby. You've got to try it. You want to refill your prescription? Show you how easy it is to do it on this app. You don't even have to place the phone call to the pharmacy to refill your prescription. You can do it right from an app, that kind of thing, right? So the more comfortable the staff person is, or the clinician, provider, it could be a CNA, it could be anybody in that office, on helping those people use the tools that they have now at their disposal, the easier it is to get the end user to use it. Because that's the one step removed that all of us are as healthcare professionals, is that obviously I'm not with the 80-year-old who's trying the app for the first time. That staff person is. So that staff person has to be just as comfortable with whatever that technology is as the end user. And that would hold true for example, with like a heart rate monitor. It needs to be simple enough to use, simple enough to sync with whatever device that they have, so that that data pulls through for the clinician to view what their heart rate has been over the last, say, 90 days, or however often they measure their blood pressure. So there's still some learning curves that we have to think through, right? It's one learning curve for the clinician, it's another learning curve for the end user.
For sure, definitely. Yeah. So, how do you see this sales role compared to today's versus 10 years after 10 years from now?
Uh, so I think, not to make light of or in some ways belittle sales tactics from before, but I think sales tactics have evolved, of course, to recognize that the role of a good sales consultant, a salesperson, is to recognize that they can be a consultant for the business, and wanting to be a trusted partner with the clinician or whoever the prospect actually is, in saying, I want to help you solve the problem. Whatever it is that is manually making you crazy, I want to help solve the problem. So this happened to me just the other day. I was in an office and I had the clinician walk me through the steps of what it takes once she receives a notification at the nurse's station to be able to reset that notification so that the data would show that she addressed that notification. It's very manual. Well, the moment she walks into the patient's room, why is the technology not already recognizing she's in the room? We can reset the notification. That it would be a simple thing. And when I said that to her, she said, that would be a huge help, because I have to go in and remember to reset it. So think about this. She's in that room. She gets 2 or 3 more notifications, 3 or 4 interruptions. It could be hours before that notification gets reset to say that she had already addressed that. But that's something that we could automate very simply. So that's the kind of things that I think, in a more, I don't want to say in yesterday's terms, for sales professionals, we were more about just sort of saying, here's the features, here's the benefits, here's the functionality, here's how you prescribe it, or here's how you use it. I think now we're looking at it more as a partnership. Let me help solve what issues you're dealing with. Let me understand the issue first. Let me take it back to my engineers, and let's find a solve for it.
Yeah, that's actually a very good idea. When you walk through some clinic and then automatically taking that next steps, and it's really interesting. That's a very good thing, actually. Hello, technology folks, please listen to this. So, what's the biggest challenge you see in the sales area because of the growing technology demands?
Well, of course, technology is, again, only as good as the ability for them to access that information as quickly as they possibly can. The more arduous the task, the less likely they are to use it. So I'll use, for example, when EMRs first became the norm, I remember prior to that, of course, clinicians were gripping those manila folders with white knuckles going, please don't make me put all this into a computer. And to be fair, we're still struggling with how many different clicks it takes for them to get a new patient set up, how many clicks it takes for them to refill a prescription, how many clicks it takes. And there is a tremendous amount of burnout that is attributable to the amount of documentation that people have to do on any one patient after they've seen them. So, again, I think where technology can be helpful in terms of expediting and speeding up certain processes, it has a long way to go to make it more uh, customizable in some sense, that the person at the front desk needs different things to show up that allow him or her to easily get somebody registered who's new, that could be way different than the user interface in the back of the office where they're doing lab work, for example, and just need to be able to access the file and populate the results. So you can see how there's not a one size fits all platform that would prevent somebody in the front having to take 20 extra screens just to get somebody set up, so that the person in the back only needs two screens, right? So we have a long way to go with that.
Mhm, mhm. So the targeted audience that you're talking about, mostly old age people, I believe. So, or senior citizens, I would say.
I mean, think about it. I mean, logically, as we age, the number of doctor visits per year goes up. um, I wouldn't say exponentially, but it is obvious, of course, as your medical conditions might necessitate specialists and things like that. So up until probably your early 60s, and I'm not trying to quote statistics here, but up until your early 60s, you're probably going to the doctor about once or twice a year, once for a well check, once for a sick visit. Beyond your 60s and into your 70s and 80s, as you pick up a pulmonologist and a cardiologist and a nephrologist and an oncologist, even if you only see them once every 3 months, 6 months, a year, you've added to the number of appointments that you're going to. The other thing we have to recognize is that we are, as a planet, aging more rapidly than in previous years, meaning our younger population is getting out paced by the people that are living well beyond 65, so that we are, in essence, in this sort of interesting phenomena where there are not as many people that are under 65 as there are older than 65. And there are actual countries where there are more people that are over 65 than there are under 65. And so, with that sort of dynamic, we recognize that healthcare is really more about what are we doing for the 65 to 95-year-olds, and less about what are we doing from the zero, well, not zero, maybe 15 to 60-year-olds, because obviously when they're younger, of course, there's more healthcare needs there as well.
Yeah, the reason I brought that point is, do you think are these companies intentionally leaving that technology gap because the people who are over 65 may not be using, the apps and all more efficiently compared to the young generation, young kids? Or do you still believe that this has to be improved?
I think there's some work to be done. Recognize, of course, I'm 55, so I'm 10 years away from retiring, obviously, and 10 years away from that 65 and older piece. So I'm obviously more tech savvy than someone who's 80, who grew up without computers and without even mobile devices for the most part. So we're going to be able to naturally get over that hump, because we have new generations of people that have gotten so used to technology. I mean, I think, you could make a case that newborns are born with an iPhone in their hands, right? So there's sort of this understood technology gap now that won't be there in, say, 10 to 15 years, because people like myself, when we get there, we're going to be more comfortable with where technology is anyway. In the meantime, I think this is where we can use some of our positions like the care navigators and some of the caseworkers and other types of allied healthcare professionals to really help them feel comfortable with those tools, to enable them to help the end user feel more comfortable with those tools. So again, thinking about it from that end user perspective, really trying to simplify the number of times I've got to click on something or activate something, just thinking through that piece for the end user, so that we can train that middle person to really provide that instruction for that end user.
Hmm. So, in your area, the sales side, I believe you see lot of you hear lot of no's and rejections when you approach to sell something, right? So how do you handle the rejections?
I never get no's. What are you talking about?
You are the luckiest person on the planet then.
So, do you want to know how I handle them, or do you want to know? Oh, sort of. Okay. Uh, Well, a no is a no. To me, a no is a not yet, right? A no is no for now. And so, for me, if I get a no, it's usually for me to figure out what the no really is. Is it because uh, they haven't felt that there is a need yet, or they perceive that the need is too big for them to make the change, or whatever it is for me to peel back that onion and figure out what is really driving the no. If the no is a budget issue, then let's look at this for next budget year. I mean, if it's a timing issue, let's talk through what the timing looks like. How often do you change your technologies? How often do you upgrade? How often do you reevaluate? What is your criteria when you're looking at new vendors? So all of those kinds of pieces play into the no. Again, the no for me is really just an opportunity to say, okay, granted, we're not going to sell you anything today. So let's talk about what next steps look like for you. What are your objectives for next year? What's your technology budget for next year? What are you hoping to accomplish? What are your greatest needs in your mind? Uh, for example, in the hospital settings, there's a huge need to keep their patient experience numbers up because it directly impacts their reimbursement rates from Medicare. So to be able to figure out how they even define patient experience, and patient experience is all, it starts way before they get to the doctor's office. It starts in the parking lot. How hard was it for me to find a parking space? How hard was it for me to get through your hospital doors? How hard was it for me to find the office? Were the people friendly that I had to stop and ask for directions? It's those types of things that all impact that patient experience. If you liken it to anything else that you would obviously be able to relate to very well, if you were to go to a new restaurant, your whole restaurant experience is much bigger than the steak you're eating. It's all about, what is the access and parking? What is the lighting like? What is the ambiance? What was the waiter like? How is that interaction? It's all of that that builds that restaurant experience for you to say, that was fantastic. Otherwise, we would just all order steaks and eat them at home, right? Like if that didn't matter. But the patient experience is critical to helping people want to re-engage. So the more comfortable I am getting to that facility, getting through that facility, then the better my overall experience was in interacting with my healthcare professional, who obviously has no control over whether or not there was a parking space out there. But we have to think through that because that's part of the entire healthcare experience for them.
I learned something new today. No means not no. Yeah. Keep following up, folks.
Told you I don't ever get no's. No, I'm just kidding. Of course I do.
No, that is really inspiring, actually. That helps so many people. And so, what makes you passionate and gets you motivated?
So again, I'm trying to make a positive impact in some way, right? Like even if I can't help your patient, if I can help your business, if I can help your something, right? Like let's just say I show up and I don't know, the microwave is out and I need to go order pizzas for you. I mean, I'm sort of downplaying my role. I'm just saying that it doesn't have to always be, how quickly can I close this deal? It has to be with, I'm reliable, I'm consistent, I'm going to bring the right information to you. If I don't know something, I'm okay saying that. And most good sales consultants will tell you that. They'll say, look, I am probably not the best source for that answer. I just know exactly where I need to go to get it. And so I will circle back with you and bring the correct answer to you. Or I'll bring the expert with me next time. So if it's a very detailed technical issue, you don't want Libby answering it. You really want that software engineer on the phone with them. But at the same time, I'm that liaison, right? Like I'm the person that puts those people together, helps the person who's on my side as the software expert to say, this is what's going on. Let me break this down for you. This is what's happening. This is what they're seeing, right? Because I was there and saw it myself. And then also help the clinician when he gets that information or she gets that information really understand how that's going to fix their problem. Because there's sort of I don't want to say there's a challenge with language, but there is. I mean, you've got computer language and then you have provider languages, and those are not the same.
That's interesting, Libby. So, what are the most helpful resources that have helped you along the way in your career?
In helping me learn healthcare technology, or helping me just learn healthcare, would just help me healthcare
Healthcare
technology.
technology. Yeah.
Uh, well, of course, I subscribe to half a dozen online publications that allow me to become better versed. I think the other uh, thing that I do, and I tell people this all the time, is that when I get a new product or get a new feature or get a new something that I'm wanting to sell, I'm a deep diver. Like, I have to go learn way more than what I would ever need to share with somebody else. So I need to know the ins and outs, not just of the technology, but of the particular scenario with a problem that we're trying to fix. So again, go back to the workflow. If I didn't understand the workflow, then how do I know whether or not my technology is going to help or hurt? So I really, really do my uh, homework on that. I will read articles about, a clinician's workflow through nursing station notifications, for example, or nurse station notifications, or whatever it is, so that I feel as comfortable talking through it at a different level, right up here, because I already know way more than I need to know. It's not unlike what a software engineer would tell you, right? Like, there's a lot more that you know about how you do what you do than you would ever tell me. Because it gets too complicated too quick. I mean, when I look at some of these, when they do those sort of like stand-ups where they explain, here's what I'm working on, and they'll show us from a UI what they're working on. That's fantastic, right? They pull back that screen and they show all that code, and I go, wow. Like, it's and they'll go, oh, you want me to make a little change, Libby? Okay. And then they go find some line in the middle of nothing. I'm like, how would you know it's that line? That's like line 147, 6 characters over, and you changed it to an exclamation point, and that changed the whole thing. Like, I can't fully grasp how much I don't know about how to actually do that, right? So on the clinician side, I try to do the same thing. I try to understand what it is they're actually trying to do or solve, and what the hiccups are, what the roadblocks are along the way, right? And so a lot of times I'll read about those types of issues on a much larger scale. Staffing shortage, for example, the staffing shortage is not going to get easier. It's going to get worse, right? Like, this time next year, the prediction is going to be that we're going to be about 500,000 nurses shy of what we need in the United States. That's not going to be solved overnight. Nursing schools cannot turn out nurses fast enough. Primary care physicians, another huge shortage that we're going to have to face. So we're going to have to do more with less, right? So to understand what we say when we say staffing shortage, you need to kind of know that this problem didn't start post-COVID when everybody left the hospitals. This problem has been going on for decades.
That is actually so fascinating. Someone from the sales background talking about the programming, the coding, how the software engine is changes. I can resonate that. You don't have to. A
Of
lot of people
course, I'm
doesn't even
speaking your
know.
language, but I don't know that language at all. I was like, Python is a snake. I don't know how in the world it ever got
Yeah.
to be a
So, how do you define
programming
success in
name.
healthcare technology?
So success can have different meanings in different contexts, right? So again, let's go back to the fact that, of course, I'm going to hear a lot of no's. So success just could be that they don't throw me out the next time I go into the office. I mean, I can lower that bar. Success can be, obviously, of course, as we move through it, finding some area where we believe we have a potential partnership. And that could be on a very, very small sliver of a patient demographic where it is appropriate to use my technology, or it makes sense to use my technology. So when the budget and the timing and all of that come around, they go, I'm going to ask Libby to bring that in now because it's time for us to take a look at that, right? So success to me is also being recognized again as not an expert. I'm not an expert in healthcare technology. I'm a facilitator. I'm the person who coordinates the experts in the technology piece with the experts that are in the healthcare piece and helping them figure out how to resolve or solve a problem that each of them recognize can be solved through technology. So the clinician, again, might bring the issue to me. I would like to be able to do X. And then I will take that issue and say, I don't know if our software can do it, but let me take that to my engineers and let's look at whether or not that's feasible. And then we talk about how applicable that might be to all kinds of physicians or all kinds of clinicians, right? So then it becomes sort of scalable in the sense that, gosh, if we made this change, this could be helpful for a lot of the providers out there.
What is one book that you recommend to our listeners?
So for sales folks, I think the book is The Who Moved My Cheese. That's the easiest book. Of course, it's a quick read, which most salespeople want a quick read, but it's also a quick concept to sort of grasp, which is the idea that by the time you get to where the cheese is moved, right? Like you have to keep moving, you have to keep evolving. Your sales cycle will, of course, reset itself as soon as that deal is closed. Now you've got to figure out what the next step is in that partnership, right? So it particularly in software where you have this huge service component, it is all about making sure that through implementation, through the launch of the software, that you're really giving that support, wrapping it around them, making sure that you're seeing to it that it gets all the way to where it's fully launched, and then immediately start looking for ways that we're going to continue to drive success into that partnership, right? Because we are not selling widgets, we are selling relationships. So the Who Moved My Cheese is a recognition that your work is never done. There will always be something else. And it is not unlike what everybody knows about technology. The second you buy the technology device, whatever it is, it's outdated, right? I mean, that is the reality. So in the tech world, that's understood. I mean, we heard about AI as a consumer about 6 months ago, maybe a year ago. We started hearing sort of the scuttlebutt about AI. AI is so far out in front of us now. It has moved dramatically since we first started hearing about it just as consumers. So that now every time I type something into my computer, it's trying to get me to use AI to better phrase my question, better phrase the answer. So all of that goes back to the Who Moved My Cheese. And it's a philosophy about how you embrace change. It is a philosophy about how you pivot, right? Because just as soon as you learn how to do something well, you're going to have to learn how to do it even better. And that's, to me, what that is all about. Obviously, that's an older book. I try to read books in lots of different places and spaces to try to challenge me to think sort of outside the box. Most of them are related to really trying to be authentic to my audience, whatever it is, whether my audience were kids I'm teaching how to swim or it's people that I'm teaching my software to. It's trying to be my authentic self, speak in my voice, because I think that is the way you build credibility and maintain credibility with your clients.
Who moved my cheese? That's a key takeaway for our listeners. Thank you so much for sharing, Libby. And one last question. What do you want to share or advise for our upcoming tech leaders?
This may sound a little trite because it's certainly an expression that you've heard before, but there are no bad questions. There really aren't. It wouldn't matter if it's an acronym that people use all the time in technology that is not well known by the clinician or the other way around. Somebody else in that audience is having that very, very same thought. I don't know what they're talking about. I don't recognize that acronym. I don't recognize that language. I think the more willing we are to just acknowledge that we're not following, we're not tracking, we're not, I want to understand this so much that I'm willing to pause you and say, I'm lost. I'm going to need you to back up, right? We've been conditioned to sort of try to always be the smartest person about everything that we're ever encountering. And the reality of it is that I can only be smart about certain things and I can be really, really super smart about them. But about other things, I'm not smart. So I go hire experts who are smart. I mean, it wouldn't matter if we were talking about something like doing taxes or something like being in a courtroom. We hire experts all the time who are really, really good and keen and several layers deep in whatever their skill is. But in technology, and sometimes when technology interacts with everyone else, the person, the audience, feels slightly intimidated because, again, when I see all that code, I'm overwhelmed by how much I do not know about how to program, right? Like I came up during the days when you had to program like a little cursor to go across the screen, right? And I got an A in my computer class. You know, you don't even program that anymore. That's already done for you, right? So being able to invite someone from the very beginning to say, we're going to go over this today. I encourage you to push back on me until you feel comfortable. I encourage you to ask questions. I encourage you. And almost planting people in the audience who are willing to ask that first question. You know who the smartest person to ask that first question? Get that CEO to ask that first question. Just ask them to ask that first question because it sets the tone for people to say, I don't understand. And I think that would go a long way to helping people all get aligned by the end of a call or the end of a meeting or whatever it is they're trying to accomplish. The servant leader concept is is so valued in business and sometimes forgotten when people feel intimidated by the technology gurus that so many of them are. So I usually try to ask the first crazy question because it lets others feel comfortable. I've had people say to me in the Teams chat, "Thank you for asking that question. I was thinking of it." And that's all of life, really. It's really okay to say, I'm not following you. It wouldn't matter if you were talking about landscaping or talking about a physics problem. It's all the same. I may not understand it, but I'm willing to acknowledge I don't get it until you help me get there.
Ask the questions. That's very interesting. Thank you so much, Libby, for joining with me today and helping our listeners by sharing your valuable information and inspiring story.
Thank you for the invitation. It was fantastic to be here.
Signing off, Value Tech with Libby.